Good morning, everyone, and welcome to today's presentation. I'm Dr. S.K. Singh, holding a PhD, and I will be guiding you through the topic of calculations for the bacterial endotoxin test. Today, we'll explore the key concepts and methods involved in this important aspect of microbiological testing. Over the course of this session, we'll cover the fundamental principles, calculation techniques, and some practical tips to ensure accurate results. I'm excited to share this knowledge with you, so let's get started. Today, I want to highlight a critical aspect of product safety, ensuring that our products are free from harmful bacterial toxins. BET, or the Bacterial Endotoxin test, plays a key role here. It's a standardized or compendial test used to detect and measure endotoxins. These are lipopolysaccharides that come from the cell walls of gram-negative bacteria. Why is this important? Because if these endotoxins are present in pharmaceuticals, raw materials, or medical devices, they can cause serious reactions like fever or shock when administered to patients. So, BET helps us identify and quantify these endotoxins, ensuring that what we deliver is safe and meets regulatory standards. It's an essential part of our quality control process, directly connecting to our overall goal of patient safety and product integrity. Let's take a closer look at where, which represents the labeled sensitivity of the lysate, is expressed in international units per milliliter, or EU/ml. This value is crucial because it tells us how sensitive our lysate is in detecting endotoxins. Now, when we talk about the concentration of the sample solution, it varies depending on how the endotoxin limit is specified. If the limit is given by weight, we express concentration as milligrams per milliliter, or mg/ml. If it's specified by units, then we use units per milliliter, or units/ml. And if the limit is defined volume-wise, then the concentration is given as 1 ml per milliliter, which is essentially a volumetric measurement. Another key concept here is the MVD, or maximum allowable dilution. This is the highest dilution factor at which we can still reliably determine the endotoxin limit. Understanding MVD is important because it helps us optimize our testing process, ensuring that we're diluting enough to stay within detectable ranges, but not so much that we lose accuracy. Finally, the MVD is calculated using a specific formula, which ties together the sensitivity of our lysate, the concentration of the sample, and the endotoxin limit. This calculation guides us in setting up our bacterial endotoxin test, or BET, properly. Overall, these concepts are fundamental for ensuring that our endotoxin testing is both accurate and compliant with regulatory standards. Let's take a closer look at the concept of endotoxin limits. Here, K represents the threshold pyrogenic dose of endotoxin per kilogram of body weight. For most parenteral preparations, K is set at 5 EU per kg, except when the product is administered intrathecally, in which case it's much lower, at 0.2 EU per kg. Now, M stands for the maximum dose administered to an adult, which we typically consider as 70 kilograms. But there's an important nuance. If a product is infused or injected repeatedly over an extended period, M is based on the total maximum dose given within a 1-hour window. This helps us understand that the endotoxin limit for a product depends directly on the dose. Since the effect of endotoxins correlates with the amount present in the administered dose, calculating the limit involves dividing K by M. So, the endotoxin limit essentially tells us the maximum allowable endotoxin level in a product, ensuring safety based on how much of the product is used. This is where the bacterial endotoxin test, or BET, comes into play. It's a key tool for verifying that our endotoxin levels stay within these established limits. Overall, understanding this calculation helps us maintain safety standards in our pharmaceutical products and protect patients from pyrogenic reactions. Now, let's take a closer look at how the endotoxin limit is calculated for different medical devices. For general medical devices, we use the formula K times N over V, where K represents the amount of endotoxin allowed per device. Specifically, the limit is set at a maximum of 20 EU per device, or 2.15 EU for devices that come into contact with cerebrospinal fluid. N is the number of devices being tested, and V is the total volume of extract or rinse used during testing. It's important to note that for radiopharmaceutical products not administered intrathecally, the limit is calculated as 175 divided by V, with V being the maximum recommended dose in milliliters. However, if the radiopharmaceutical is administered intrathecally, the formula changes to 14 divided by V. When it comes to formulations like anti-cancer drugs that are dosed based on body surface area, the calculation shifts again. The endotoxin limit is determined by dividing K, which is 2.5 EU per kilogram, by mm is calculated based on the maximum dose per square meter per hour, adjusted for a standard body surface area of 1.8 square meters and a body weight of 70 kilograms. For example, if an adult patient weighing 70 kg receives an intramuscular injection with a maximum dose of 300 mg, we can determine the endotoxin limit by multiplying 5 EU per kg by 70 kg, then dividing by the dose in milligrams. This results in an endotoxin limit of approximately 1.16 EU per milligram. Finally, let's briefly touch on the bacterial endotoxin test, or BET. This test is essential for ensuring our products are within safe endotoxin limits. It involves specific procedures to detect and quantify endotoxins, helping us maintain safety and compliance in our manufacturing processes. Now, let's look at an example to understand how these values come into play. We have an injection with a concentration of 100 milligrams per milliliter, and the endotoxin limit is set at 0.2 EU per milligram. The lysate we're using in the test has a labeled sensitivity of 0.03 EU per milliliter. Using these figures, we can calculate the maximum valid dilution, or MVD, which helps us determine the safety margin. The MVD calculation follows a specific formula, often referred to as the BET by gel clot method. This process is crucial because it ensures that the endotoxin levels in our product stay within safe limits, maintaining product safety and compliance. It's a key part of our overall quality control strategy in bacterial endotoxin testing. Let's take a closer look at the bacterial endotoxin test, or BET. This test is essential for ensuring the safety of pharmaceutical products, especially those that are parenteral. Endotoxins are toxins released by bacteria, specifically from the cell walls of gram-negative bacteria, and they can cause severe reactions if present in injectable products. The main goal of the BET is to detect and quantify these endotoxins to prevent contaminated products from reaching patients. It's a critical quality control step, helping us verify that our products meet safety standards before they are released. The most common method used is the limulus ambosite lysate, or LAL test, which is based on blood from horseshoe crabs that clots in the presence of endotoxins. This test is highly sensitive and specific, making it a reliable tool for endotoxin detection. In the context of overall product safety, performing the BET aligns with our commitment to protect patients and ensure the integrity of our pharmaceutical manufacturing process. It's one of those vital steps that helps us maintain high quality and regulatory compliance. Now, let's take a closer look at the BET by KTA method. The bacterial endotoxin test, or BET, is a crucial part of ensuring the safety of pharmaceutical products. It helps us detect bacterial endotoxins, which are potentially harmful substances derived from bacteria. These endotoxins can cause severe reactions if they enter the bloodstream, so testing for them is essential. The KTA method specifically refers to a technique designed to improve the accuracy and reliability of this test. It's important because endotoxin contamination can occur at any stage of manufacturing, and early detection allows us to prevent compromised products from reaching patients. In essence, the BET by KTA method is about maintaining the highest safety standards in our pharmaceutical processes. It connects directly to the overall theme of quality assurance, ensuring that our products are not only effective, but also safe for use. So, Understanding and properly implementing this testing method is a vital step in our quality control protocols. Now, let's move on to the BET by KTA method. BET stands for Bacterial Endotoxin Test, and it's a crucial part of our quality control process. This test helps us detect the presence of bacterial endotoxins in our products, which is essential for ensuring safety, especially in injectable medicines and other sterile preparations. The KTA method, or kinetic turbidimetric assay, offers a reliable and sensitive way to measure these endotoxins. It's important because endotoxins can cause severe adverse reactions if they go undetected. Throughout our presentation, we've emphasized the importance of rigorous testing to maintain product safety and compliance. The BET by KTA method is just one of the many tools we use to uphold these standards, ensuring that our products are safe for patients and meet regulatory requirements. For further support, please feel free to contact us. We're here to help with any questions or additional information you might need. And with that, I want to sincerely thank you all for your time and attention today. Your engagement is truly appreciated, and I hope you found this presentation useful and inspiring. Remember, we're always available to support you as you apply these concepts. Thanks again, and have a great day.